So another important topic of rheumatology is Raynaud's phenomena. So it's important to take a history from the Raynaud's phenomena, because in the history we have to make an idea that whether it's a primary Raynaud's phenomena or secondary Raynaud's phenomena. So starting history from the Raynaud's is the patient has a color changes, especially when going outside. So we have to confirm that which areas having a color changes, like it's the fingers only, it's the toes only, tip of nose and ear lobes. And then start elaborating the history of color changes. So first of all, specify is it symmetrical or asymmetrical, and then how long when you go outside, how long it take to the color changes, what type of a color changes, and when you coming back to the warm area, how long it will take to settle down. And then ask the associated features like any tightening of the skin, scleroderma, any rash, SLE, any oral ulcers, SLE, and difficulty in swallowing with the Crest syndrome. And then here is an important feature to rule out the red flags, especially if you develop any wound or ulcers on the fingers. Have you ever had severe pains, any color changes like any black color of the fingers? And then check with the patient's job, whether is a fishmonger, or the patient is using some vibrating tools, or just a patient just going outside in the winter walk and developing these features, and what patient has used or what patient has did any modification in the lifestyle. Coming to the management, explain the Raynaud's phenomenon in a simple way, that it is a condition in which the blood vessels become narrow and causing these symptoms in the hands. And if this is associated symptoms, we can also ask the patient that sometime we could not find any cause, but in some cases there could be some underlying conditions like SLE, scleroderma, Crest syndrome. If you're suspecting these conditions, always call the patient for examination, check the observations, check the blood pressure, and do the blood tests. And if you're suspecting these conditions, tell the patient that we will involve the specialist doctor. And then explain the patient that this condition can be due to happen cold or emotional changes. So usually lifestyle measures can help. If patient has already used all the lifestyle measures, don't want to go with that, we can given the option to the patient, like there is a medication called nifedipine that can be used. But they are you allergic to any medication, and this medication has some side effect like lightheadedness, dizziness. And then we can explain the patient to follow up. We'll call you follow up in 3 to 4 weeks time just to see how you are doing. Try to get modification for the job, and if patient needs any kind of a modified work note, just try to avoid the exposure of the cold which is causing the symptoms. And then coming back to the safety netting, very important. If the symptoms is worsening, contact us back. But if you're developing any severe pain which is not stopping, or developing changing in the color of the fingers like black fingers, go to hospital or call 111 for the advice. So it means it's urgent medical advice. And yeah, that's all. Thank you.